Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoy this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with John Cooper of Minimelife. John, thank you for joining us.
Thank you very much, Hall. I appreciate the opportunity.
So can you tell us about your background before joining Minimelife? What were you doing before this?
Sure. Well, my name is John Cooper. I have been in the healthcare field for most of my life. Over the last 14 years, I have been practicing as an attending vascular surgeon right here at Virtual Health System in New Jersey. And I have noticed better health outcomes when my patients are involved with their healthcare. In educating my patients, the better I can illustrate the medical information to them, the better they seem to understand their health. So I decided to create the application that not only can teach patients, but also put the control into the patient's hands for their medical records, which I call Minimelife.
Well, that's great. So you've seen the healthcare space from several angles. For the investors out there, what's your advice for people investing in the healthcare space? What would you tell them?
Well, anything really that helps patients navigate and puts them in control of their experience as a patient in healthcare. Many patients are coming to realize that some of the biggest problems that we have in the healthcare today is patient involvement and in their healthcare decisions. So I think anything that helps patients' involvement, management, and even communication would be highly successful in the healthcare market. There's certainly been a lot of amazing growths and innovations in the healthcare field, not just surgical procedures, but also artificial intelligence, augmented and virtual reality, and even remote patient monitoring. I think investors should be definitely focused on innovations that help the aging population, as the baby boomers are just turning 65 and hitting Medicare age. Also, just the large population of unhealthy people and a severely fragmented health system. I think, therefore, when considering investment in sort of the healthcare space, innovations that focus on consolidating current information, population health, and patient-centered care appear to be common denominators for the next few decades to come.
So the healthcare industry continues to grow dramatically in cost. How do you see that evolving going forward? At what point does the cost come to an end at this point?
Sure. Well, I mean, the industry overall has definitely been evolving more from a volume to a value-based care. And as a physician, I've definitely seen several trends that have been playing out. Certainly, there's a large collaboration between health systems and health plans and making and meeting patients' metrics. Also, definitely a shift towards wellness rather than illness, and technology, which can put patients at the center and give a handle on their own personal health information. We see definitely an increased adoption of virtual care visits. And in 2020, Medicare is going to start to reimburse some of these virtual care visits and even text messaging systems. And lastly, definitely a greater focus overall on the population health. And that's what we're seeing here in the future as the baby boomers and going forward reach this pivotal age at 65 where they start getting more health problems that need help. And that's sort of how I designed the Minimelife app, which is certainly to address some of these key trends. It focuses on improving the patient's quality of health by increasing access, connectivity, and consolidation.
So let's talk more about Minimelife and how does that fit into the overall landscape of EMRs and other systems that are out there?
Sure. I mean, Minimelife is a broad-based platform. The platform centralizes patients' healthcare records that the patient controls and connects with physicians and hospital electronic health records. I mean, mostly Minimelife integrates with wellness apps, telemedicine, wearable devices, and remote monitoring systems. It will collect and analyze data, and if the patient so chooses, the data can be shared with other healthcare providers, hospital administrators, payers, and even policymakers. Minimelife overall, it provides an easy navigated social and supportive environment for patients to connect to physicians, also to nurses, physical therapists, nutritionists, and caseworkers, as well as users with similar medical problems. The platform overall, and as a physician, I know I need the help. The platform alleviates the burden on physicians and it redistributes the responsibility to all healthcare providers. So, I think Minimelife is fun to use and the information supplies. Many people would want to use Minimelife.
Well, I know when I first looked at healthcare, I thought all of that would be inside your electronic medical record. But then as I got further into it, what I found is the EMR systems are primarily just for submitting reimbursements to the government, different codes that you use to get paid back for services you provide to the patient. It really had very little information about your healthcare or your records and all of your stats. It was mostly just the codes. And so it seemed like your data was spread among a number of other things. Is this tool integrating all of that into one system?
Yeah, we're seeing that specifically, how a lot of these electronic health records and a lot of the companies that develop the healthcare records sort of align themselves for practices and physicians to profit by making sure that they add a lot of data to their patient records to maximize their reimbursement. And that's sort of switching. And now going towards value-based care, physicians are no longer able to sort of try to maximize reimbursement by adding that data to their health records. And the physicians now need to hit different metrics to be able to meet these reimbursement requirements. So I think a lot of the EHR systems are sort of switching around. And we need to sort of help the patients be able to put all of their fragmented records sort of together in one place that physicians and other healthcare administrators or providers can access. And I think Minimelife overall is positioned to link some of these remote patient monitoring data from different wearable and implantable companies to their medical records. It can also link the wearable data to patient ICD-10 codes, even the CPT codes, the BMI, and even the medications. So the platform is built more or less to integrate with other companies as opposed to just completely stand alone and to collect the data. And I think when you look at some of these other companies, a lot of them have limited sharing capacity. And Minimelife can share this data easily with physicians and hospital electronic health records, as well as insurance companies. And this is really done through a corporate membership. Minimelife will be the main hub that connects not only companies for data analytics, but also companies related to telehealth, wellness, pharmacies, insurance companies, radiology, and laboratories, and brings all of that information to the patient's record in one location. And then the patient can then choose to disseminate that information to healthcare providers, or as I said, insurance companies or administrators. So I think that's where Minimelife sort of fits in, is to sort of collect all the data from the different companies and put that information in control for the patient to use.
So how many data streams are you finding that an average patient has? You mentioned insurance, EMR, and pharmacy, and the doctor's office, and there's probably a specialist office, but there seems like there's even more out there. How much data are you dealing with?
Well, I think overall an enormous amount. And I sort of learned about this the hard way. Certainly as a physician, you do lose sight of the difficulty that patients have, but dealing with this with my father, I watched him suffer from prostate cancer and even heart disease. And I personally struggle to keep track of his appointments, medications, doctors, and treatment plans. So you have a lot of different information, the medications, some are at the pharmacies, some are in the hands of the physicians, and some are at the hands of the patients. And still I have patients saying that these medications are not the current ones or these are the wrong ones. Then you have these other like wearables where people have, let's say, the Fitbit that information is sort of isolated for the patient. So when you start just to look at the other companies where people are now sort of signing up to get more control of their health information, you have difficulty trying to put it all in one place. But it gets more complicated by that. And again, with my father, his cardiologist and his heart surgeon were in one health system, DeBoer Heart and Lung Center. He had a primary care doctor and he received radiation therapy in a different health system. And then his oncologist and chemotherapy were at another hospital system. And then his urologist was in a private practice. And even as a doctor, I found it difficult to communicate with all of his healthcare problems. So I think there's a lot of data that is all fragmented for a patient. And that's really what makes it confusing and hard to navigate the healthcare system. And again, why I sort of looked at Minimelife, which is a common hub or a central hub that can allow patients to create links for the different wearables, but also to keep their records with them on their mobile device. I think the number is high. It's at least a half a dozen that are tangible for a patient. And then you have a lot of untangible records that patients have to gain responsibility for. And right now, the physicians are responsible for.
And how does telemedicine impact that number? It seems like more and more things are going online with online videos and remote patient-doctor interactions and so forth. So it seems like there's yet another stream of data coming into this through the telemedicine that seems to be coming up in a bigger way all the time.
I think telemedicine is definitely going to continue to grow, and some of the numbers continue to show at least $25 billion going into telemedicine. I mean, the telemedicine companies themselves keep their own patient record. So patients enter their medical problems and their surgical problems that are at the fingertips for healthcare providers. But the telemedicine are usually focused on disease and problems that patients have as opposed to sort of wellness. And I think we have to more or less shift towards an idea of wellness versus sickness. So I think the telehealth is going to continue to grow. I think it's going to be enormous and it's going to be important. I personally would like to see telehealth communities sort of use Minimelife as part of their platform, if not for their medical records and some of the other data that we will collect, but also for the Minimi body where physicians or providers can actually have a illustration or models of the patient's health that can then relay the information in easy to understand terms for patients.
Well, right now, your doctor, as you said, has your data, the hospital has your data, everyone has your data, but you're putting it all in the hands of the patient, so the patient will have their own data, and they'll carry that going forward, and they'll own that data, so to speak, and they'll be able to give it to who they want to give it to. When do you think that switch will really come into place in the current healthcare system? Is that this year, or is that already started happening? I myself don't really own my data, but I think it's coming. Like you say, it's going to be a core tenet going forward, is everyone's going to have their own data, and we'll need tools for that. When do you think that transition is going to happen?
It's already starting to happen, Paul. We as physicians are trying to empower patients right now to take control of their health information. My metrics and reimbursement currently is linked to patients accessing their healthcare portals. So I am responsible, the practice, the hospital system is responsible to get a certain percentage of patients signed up for their health portal. So back maybe a year ago, maybe a year and a half ago, we really only saw a utilization of healthcare access or their portals about 11% in this area. I mean, some other areas have higher percentage of utilization, but 11%. That number now has been about 21% in our own hospital system, but we're trying to get that to 70%, 80%, where the patients can access their healthcare records and have control. So again, my reimbursement right now as a physician is tied to patients signing up to those patient portals. So it becomes more important for us to motivate and empower patients to start taking control of their healthcare. And again, this is just one limited site because you have a lot of different electronic health records. And in certain areas, some people might belong to 2 or 3 different healthcare systems and have different health systems. And each of those health systems with different EHR systems are really trying to get patients to sign up for their portals to try to get the burden back on the patient to start thinking about health and being healthy.
Well, it seems like that's a major change in the healthcare system because I know in the past, many EMR systems were free to the doctors or the hospitals because they were basically making money selling the data to pharmaceuticals and others out the back door. And while that's not illegal, that probably wasn't what people wanted. And here, if someone owns their data and they have access, they control the data, that seems like that's going to change a lot of the business models that are out there in the industry.
I think it is. Already, I mean, the whole business model for a health system is changing. In 2020, we're not going to be able to build different levels of care just based on their EHR and the data that we are entering, which is sort of what the paradigm is now. We are going to be able to bill a base payment for Medicare. And then we are going to have to meet different metrics and put in their care plans just to be able to get some of that other money that we typically have already been getting from the healthcare industry. So again, trying to have people stop smoking or trying to lose weight or keeping control of their sugars or their hemoglobin A1C, we are seeing a big shift of that responsibility for patients to start taking control.
Well, that's great. Well, in the last few minutes that we have here, what else should we cover that we haven't?
I mean, I think overall it would be worthwhile, and we sort of commented on it before, but definitely worthwhile mentioning the social impact of Minimelife in the healthcare space. And personally, I know that healthcare system is an intimidating experience for most people. But Minimelife makes healthcare understandable and simple and puts control in the patient's hands. It does this by creating a customizable, friendly interface that enables people to join and create healthcare support groups, also track family health records. So you will be able to control all of your health records of the family, as well as connect with friends and follow healthcare providers and trends. So I think going forward, Minimelife will have a huge social impact, and I think it will be a main hub for different healthcare systems to sort of plug into to get the important data to help get patients to focus on health.
Well, that's great. Well, how best for listeners to get back in touch with you?
Probably my email account would be best, which would be jhcooper02@gmail.com.
Well, great. We'll put that in the show notes and let people be able to access that when the podcast is produced. We appreciate your taking time to share this with us today and hope to have you back for a follow-up soon.
Okay, thank you very much, Paul.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.